I work in the field of head and neck surgical oncology at UNC, which is cancer surgery. I specifically work in the hospital after patients have had their surgeries. So oftentimes they are these large life-changing surgeries that either change the way a patient's breathing or speaking. And so it's really them and their families and friends and caretakers having to find a new normal. So I'd say what sets me apart is that I am on the floor with these patients every single day. I don't spend a lot of time in the ORs or in the clinics. We spend some, but most of the times I'm just with the patients. So it's a lot of education, teaching, like I said, not only the patient, but their families, their friends, everybody in their life, how to kind of move forward after this life-changing event and try to figure out, what's best for them. And a lot of working with case management and social work, trying to find, if patients need new things at home, if they, need to go somewhere else other than home. So a lot of those little details on top of the medical care and the physical care is just the, emotional and spiritual, psychological, all of that as well. So that's, I would say, as big a part of my job as treating them medically. My approach to patient care is talking to patients as if they were my own family members in the hospital or in, a doctor's office getting care. A lot of these diagnoses are new to the patient, something that they've never experienced, no one in their family has experienced. And so it's very overwhelming, scary, and uncharted territory. So I think just speaking to patients as, in layman's terms, as if you are telling your friend about what you do at work all day. A lot of times it's easy for us to get caught up talking medically, using medical jargon and lingo, but oftentimes, especially when patients are stressed, none of that actually resonates. So just, trying to take the time and to make sure that they understand what's going on and the path forward. That way, they feel as comfortable as they can in this really trying, scary time. I became a PA because I actually have a personal history. I was born with a cleft palate, and with that comes a lot of issues with speech and, teeth, braces, orthodontics, ears. It affects a lot to this day to where, me as an adult, I've had to have surgeries and see doctors. And so I think having that patient kind of experience really brought me into medicine, but then also kept me in the field of ENT because I do love ENT, ears, nose, throat. There's so much that you can do and so much of it intertwines. So even though, I currently treat patients with head and neck cancer, it does affect other areas that I either personally have experience in or, professionally have had like another career in. So I think that just that extra personal touch just really helps me relate to the patients. I chose UNC Health for a few reasons. I actually relocated to the Triangle area from Boston about a year ago, where I worked at a large major academic medical center in downtown Boston, which was amazing. I've always loved just that, the expertise and the love and the drive that comes from a major medical center. I love working with residents, so I really like that UNC had a large residency. Specifically on our head and neck team, there's 6 attending surgeons, and then there's at least 4 residents, and then another APP, advanced practice provider, and myself. So I love working with the team and bouncing ideas off of people and getting different opinions and takes on things and teaching and learning all at the same time. And UNC offered all of that while still treating the patients in our community. We are the state hospital, so we see a lot of patients from all over the state, from the coast, from the mountains, patients of all different walks of life. And so it keeps things fresh and new, and we're always learning and growing as ourselves, but then also being able to teach and give that back as well. As I mentioned, I moved here about a year ago, relocated from the Boston area with my fiance, who is from Boston. I'm actually originally from Illinois, so Raleigh was, the greater Raleigh area was actually a perfect mix of still kind of East Coast, but it still has some of those rural Midwest vibes as well, so it's a perfect match for the both of us. And we love to just go out to eat, go out, explore new areas around here. All of our families and friends live all over the country, so we actually do travel a lot as well to visit them. And we're planning a wedding, we bought a house, we're doing all those exciting, young adult things. And so we're very busy with our jobs, but also in our personal lives as well.